Welcome to the Working on Wellness on-demand learning series. I'm Jen Anderson, Clinical Quality Improvement Director for Community Health Association of Mountain Plains States, also known as CHAMPS. CHAMPS supports the needs of health centers in Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. Each episode in this on-demand learning series was brought to you with the generous support of our partners at the Rocky Mountain Public Health Training Center. Each of the episodes in this series was recorded in June of 2021, and each provides a different presentation from an expert in the fields of psychology, resiliency, or mindfulness, and are designed to help you reflect on your state of being following the COVID-19 pandemic. Some episodes offer tips for personal resilience, some focus on the specific needs of healthcare providers, and some help you think about the opportunities to support others in the organizations that you're a part of or that you lead. Each episode is available for you to view and share with others at your leisure. Additional resources to accompany each training can be found on the CHAMPS website where these recordings are housed. We hope that attending this on-demand training will enable you to bring new skills and tools to your job and strengthen the ability of your health center to deliver the highest quality primary care to your communities. When you're done watching this presentation, please take a moment to complete the brief evaluation that can be found linked under each presentation. For this episode, we'll hear from Dr. Jay Moreland. Jay Moreland, MD, has practiced medicine for over 30 years. He's an adjunct professor at the University of Utah in the Department of Family and Preventative Medicine. He has board certification from the American Board of Family Medicine. He also has board certification in hospice and palliative medicine, and is the medical director for the hospice program in Salt Lake City, Utah. He's been a lecturer and preceptor at the University of Utah Medical Center for both family medicine and OBGYN residencies since 1998. He does full spectrum family practice, including obstetrics. He's been an expert witness on cases ranging from breastfeeding to ruptured aortic aneurysm. He has an outpatient clinical practice at the 72nd Street Community Health Center in Salt Lake City, Utah. Dr. Moreland received a medical degree from the University of Southern California School of Medicine in Los Angeles and completed residency in family medicine at the McKay Hospital and the University of Utah Family Practice in Ogden, Utah. Dr. Moreland gives seminars, workshops, and lectures at the local and national level several times a year on a variety of topics. He's been meditating for over 25 years and has his own podcast called Dr. J's Peaceful Meditation. He plays lead guitar in a band called Winding Road. Dr. J, thank you so much for sharing your time with us today. Now over to you.
Hello, everyone. My name is Dr. Jay Moreland, and I've been asked to speak for the CHAMPS series on working towards wellness. And thank you very much for having me today. My talk is on meditation and mindfulness and prevention of burnout. I'm a family physician and a hospice and palliative care physician, and I've been practicing meditation for about 30 years now. Welcome aboard, and I hope you enjoyed the talk. And okay, this is my website where I do a podcast. We are now in 86 countries and territories, and as of today, 893 cities. There is the URL, and please feel free to listen to the podcast. Usually it's a few minutes of a talk and then a few minutes of a podcast. It's not very long, and you can get at it with many different avenues for listening to the podcast. And please give me feedback and tell me what you think. So today I'm going to talk with you about a variety of things, but by the end of the visit, I want you to know about burnout and some of its causes, about the benefits of meditation and mindfulness. I'd like you to know some of the science behind these topics and how to do some basic meditation and mindfulness. So, burnout has been studied, and there are two main aspects of burnout: emotional exhaustion and depersonalization. And for me, this translates into decreased compassion. And of course, for us in healthcare, that is not a very good thing to experience when we're taking care of people. So if we can prevent burnout, we can also be better practitioners of healthcare. So burnout is an epidemic. All physicians are at a significant risk, and more than 50% of us now have it. In my field of hospice and palliative care, over 62% were shown to be having some signs of burnout. Certainly physicians show this, but PAs and nurse practitioners and other medical staff are at risk as well, but certainly less studied. Burnout is everywhere. front desk, MAs, billing office. It's all around us and in other positions and professions as well. Of course, with us, we have the EMR that provides an extra layer of stress for all of us, as I'm sure you can all relate. So provider burnout results in lower patient satisfaction and care quality, higher error rates and malpractice, higher provider and staff turnover, and increased drug and alcohol use, unfortunately, and addiction risk. Also a risk for suicide. So this is not good stuff. So what is known to prevent burnout? Positive work attitudes, quality and safety culture, and meditation and mindfulness. And I would put it to you that if you practice meditation and mindfulness, naturally you will create better and more positive work attitudes, and there'll be a higher quality and safety culture. And I will provide you some of the scientific evidence behind this. So what causes the burnout? Well, pretty much the opposite of that. Negative work attitudes, lack of quality and safety culture, negative meditation, and a lack of mindfulness. And I'm going to talk about these topics as well. So first of all, what is meditation? I have a very simple view of meditation. I was taught that if you are thinking a thought more than once, you are meditating. So it's not this fancy schmancy sitting in lotus position and all that. Really, if you get down to it, meditating is just thinking a thought more than once. So there's two basic classes of meditation. There's negative and harmful thoughts, which are repeated, or positive and beneficial thoughts that are repeated. If you repeat the negative and harmful ones, you have burnout and poor outcomes. And if you repeat the positive and beneficial ones, you have longevity and good outcomes. I love this saying. This is not an ancient problem. Certainly the Cherokee knew about it as well. I love this quote. It says, "There are two wolves, and they are always fighting. One is darkness and despair, and the other is light and hope. Which one wins? The one you feed." So we're going to be talking about how to feed the good wolf. So meditation from here on out will be about positive meditation. When I'm talking about meditation today, I only mean the positive one, because that's what I recommend that you practice. Unfortunately, the other one, we are all too good at repeating. The negative one, we don't need more practice in that. So Thomas Merton said, "The least of work of learning is done in the classroom." So with that being said, let's just do a little bit of meditation. Just as an introduction, I'm going to use a meditation using the breath. This is an ancient meditation. It's been around for thousands of years. So first, I want us to begin with the proper motivation. I want you to start with the altruistic intention. By this practice, may I be a better human being and more able to help others. All right. So the traditional 7-point posture we'll use. If you're able to, you can sit with your legs crossed. It doesn't have to be the full lotus position, but you can also sit just in a chair, hands in the lap or on the knees, the spine straight, shoulders spread. They say like a vulture's wings. Your head and neck straight with the chin slightly lowered, mouth with the tip of the tongue touching the palate, and with the eyes gazing past the tip of the nose. And you don't need to look at the screen anymore. Just relax and let go of all thoughts and distractions. Now pay attention to your breathing. Let your mind focus only on the breath. Do not try to make your breath go faster or slower. Just let it rise and fall naturally. When you do this, it's normal to be distracted and have your mind leave the breath. Just bring it back gently each time. As you practice more and more, you get better at this. Now I would like you to count your breaths. Count 1 for each cycle of in and out. And I want you to count to 7 breaths and do this 3 times for a total of 21 breaths. Okay, now we can just pull ourselves gradually out of that meditation, and we can end with a proper dedication. We say, through this practice, may I be a better person and more able to help others. That's our job in medical care, isn't it? So let's talk about mindfulness. Mindfulness. What is mindfulness? First, I want to talk about meta-awareness. So meta-awareness is the ability to observe your thoughts, feelings, sensations, and impulses as they are happening. And meditation teaches you how to have better meta-awareness. So hopefully you guys saw with your meditation that you became a little bit more aware of your feelings and sensations and as they're happening at that moment. So meta-awareness is being aware of that. So what is mindfulness? Well, mindfulness is having that meta-awareness in the present. So your body and your mind is in the present. It's not in the past. It's not in the future. It's in the present moment. So meditation teaches you meta-awareness. And when you notice your thoughts and feelings in your present moment and let them go, you're now mindfully in the present. Otherwise, thoughts can lead you around to other places other than the present. And that can be a problem. An ancient philosopher from China named Lao Tzu said, if you are depressed, you're living in the past. If you're anxious, you're living in the future. If you are at peace, you are living in the present. So I would like you to be at peace and live in the present and be mindful. So we're going to practice a little bit of a meditation that focuses a little bit more on mindfulness. Again, we start by this practice, may I be a better human being and more able to help others. We sit again in that same position. And now with this mindfulness meditation, just pay attention to the present moment. Just relax. Now sigh. That's it. Now your thoughts are a little bit like a glass of water clouded by dirt that has been mixed in. Stop agitating the water and let the water stand, and the dirt begins to settle out. Let your thoughts settle like this. Let your emotions settle. Sit in peace and awareness. Hear your surroundings. Smell your surroundings. See your surroundings. Now let go of those aspects of your surroundings and just let them settle too, just like your thoughts. When you do this, it's normal to be distracted and have your mind follow a thought. Just bring it back gently each time. Focus your attention on your intention. I want you to notice your present moment thinking, that meta awareness. Recognize that at any moment your thinking is going on almost continuously without end. But the more you pay attention to this, the more space will open up between one thought and the next. Practicing meditation in this way will help you notice what your mind is doing and will help you direct it in more positive directions. So just pay attention to your thoughts. It's interesting when you notice a thought, it disappears just like a soap bubble popping. Another arises, but that too will pop if you just look at the thought. In the spaces between, you will begin to sense more and more the peaceful abiding that is there naturally. So rest in that natural and aware mind. Rest in that peaceful and abiding mind. And as we come out of the meditation, now just bring that feeling with you. Just come out gradually and see if you can just bring the flavor of that meditation with you, that calmness, that peacefulness. Just linger a little moment as you come out of the meditation. And again, we'd like to dedicate it through this practice. May I be a better person and more able to help others. Remembering, why are we doing this? Why meditate? Well, I think that's why I like to meditate, is it helps me do those things. So I'd like to talk a little bit about the science of meditation and mindfulness. There's a lot of increasing amount of literature on the science of meditation. And if you look at this curve, on the left-hand axis, it talks about the original articles in the scientific journals, and in the right-hand axis, it talks about media pieces in newspapers. So they've both been going up quite a bit since the 2000s. And the ratio is about, for every 1,000 scientific articles, there's about 30,000 newspaper or media pieces. So a lot more interesting things going on lately. And so we're starting to know a little bit more scientifically about this. One of the places of the brain that really becomes fortified and more pliable is the prefrontal cortex. The prefrontal cortex of meditators is more active on the PET scan. Prefrontal cortex, the job of it is, it's the executive or the decider. Prefrontal cortex decides what to pay attention to differentiating conflicts of thoughts, good and bad, better, best, future consequences, and working toward a defined goal, prediction of outcomes, and social control. So that's the prefrontal cortex. Here's where the prefrontal cortex is. On the left is the front part of the brain, or where the prefrontal cortex is. And you can see that it connects to many other important parts of the brain and decides what part of the brain to pay attention to. So in the blue, you can see Broca and Wernicke's area, which is where speech and language happen. And in the back, in the sort of tan area on the right, is the occipital lobe, or the visual and spatial sketch pad. So paying attention to one or the other is that area. And then the parietal lobe up top in the slightly rose-colored area is more perceptual processing. So that's the prefrontal cortex, and what's in charge of that is right here, and that's meditation helps with that. Not only that, we know that meditation boosts a lot of our happy chemicals. What are the happy chemicals? Well, melatonin, we take that for sleep, some of us, but it's a very biologically helpful thing for sleep-wake cycle and for mood. Serotonin, GABA, DHEA, endorphins, growth hormone. There's many others that affect the mood. And meditation also decreases cortisol. Cortisol is the hormone of stress. So when we're stressed, cortisol goes up, and when we're relaxed, cortisol goes down. So just like you would expect. So there's evidence that meditation and mindfulness definitely helps us to be happier. It also helps us to have less burnout and actually more gray matter in the brain, which, by the way, is a good thing. Less distraction and better job satisfaction. And not only that, we now are starting to understand why, and I'll talk about that in a minute. So mindfulness practice is effective in healthcare professionals in improving mood and self-efficacy and empathy, and decreases stress, anxiety, and depression. So all those things that you would want to prevent burnout. So why does it work? If you focus better at the task at hand, you do a better job, and there's less malpractice. If you focus on patient needs, they will be better served and fewer mistakes. And then if you focus with compassion, of course, patients will have better health. And I'm going to talk about that. So you will find peace in the present moment, as Lao Tzu said. So I'll just share some anecdotal evidence from myself. I've been meditating now for almost 30 years, and certainly the stressors have changed, but they remain the same in many ways. But I think my outlook has changed. I feel that as the years go by, my happiness has been increasing as a result of my practice. Here's myself and my lovely wife. This is at a scientific conference on meditation and mindfulness and the scientific evidence for meditation and mindfulness in Oregon, lovely place. And my lovely wife here is also a meditator, is also the co-author and editor of my podcast, which we have been doing for a couple of years, a year and a half now. And here's my bandmates. I also play in a rock and roll band, play electric guitar and sing, and we have a good old time. I think music is also almost a form of meditation for me. There's lots of kinds of meditation. You know, people don't generally think about counting sheep as meditation, but that old thing that we used to teach people for insomnia, counting sheep, is actually a form of meditation. It's thinking a thought more than one time. Nowadays, we tend to, for insomnia, teach people how to do a body scan, almost like doing a mental CAT scan, where you start at the toes and work your way up through the feet and the ankles, etc., all the way up the body. Another meditation technique used for insomnia. But mantra can be helpful as well in meditation, words or phrases, and I'll come back to this in a minute. It's another form of meditation. There's transcendental meditation, which is silent and uses a secret mantra. And there's other kinds of meditation. There are visualization techniques that can be used as well. There's prayer, which I think counts as a meditation if you do repetitively. Certainly, you can do a walking meditation. And any thought repeated more than once, as I said, is a meditation. So one of the ways that we now know that meditation affects people is through something called the default mode network. The default mode network actually involves several different regions of the brain, and it is the basis for self, thinking about the self, or the I, the autobiographical information and self-reference, and thinking about thoughts and emotions of others as well as moral reasoning, good and bad, and remembering and thinking about past and future, and about story comprehension. And this is part of the default mode network. You can see on the left-hand side, I'll circle this area right here, is the prefrontal cortex that is involved with other segments of the brain that are now called the default mode network. And this default mode network is strengthened, is more active when people's minds are wandering. And the prefrontal cortex can help control that. So the default mode network is basically the background chatter. I watched a guy the other day who was talking about, he called it the blah, blah, blah. When your mind is blah, 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 blah. Just your mind always chattering, always chattering. That's the default mode network. And meditation and mantra can free your mind of that and calm your nervous system. Mantra meditation works for that, to decrease an overactive default mode network. And it means that the brain is distracted and not calm or centered if that's active. Anyway, it's a very unpleasant. They've studied this, and in nearby a university, Utah Valley University, they looked at undergraduates, and they basically put them in a room, locked them in a room with nothing, no TV, no phone, no entertainment, nothing, for 15 minutes, and said, okay, just be alone with your thoughts. And people didn't like it. After 15 minutes, their minds, their default mode network became very active, and they didn't like it. It was very unpleasant, a lot of suffering. And then they altered the experiment where they gave them a shocking device that would help bring them out of the default mode network. It was basically a self-shocking thing, a mild shock on their ankle that they could push a button. And a majority of the people preferred the electric shock to just listening to their default mode network go on and on and on. But it turns out experienced meditators can free the mind of that background chatter. It doesn't matter. The interesting thing about mantra is it turns out, it seems like it doesn't matter whether you recite an ancient Sanskrit mantra such as Satnam or the Lord's Prayer or any sound or word or phrase. As long as you repeat something with focused attention, you'll get results and turn off and subdue the default mode network. But I have a suggestion for you. I would like for you to pick a mantra that is meaningful to you. It can change from day to day and moment to moment. But remember that meditation is repeating a thought more than once. So my suggestion would be to pick a good mantra, positive mantras beget positive thoughts. So plug in something that's good for you. All right, so we're going to do a little practice with meditation with a mantra. Again, we're going to start by this practice. May I be a better human being and more able to help others. You can modify this intention if you like when you're practicing at home. So right now we're going to do meditation with mantra. So we're going to pick that 7-point posture again. Just sit and relax in your chair. Oops, I went forward one there. Just sit and relax. And sigh again. That's it. Once again, pay attention to your breath for a little bit as it flows in and out. Sit in peace. Sit in awareness. If your mind is distracted, just bring it gently back to the breath. Now imagine that in your heart center is a white lotus that opens up slowly to reveal a jewel that represents love. This jewel has a brilliant light and the power to radiate to you all happiness and loving kindness. It radiates out to every pore in your body, blessing you with love and happiness. Now, from that jewel in your heart center, imagine that you can radiate out loving kindness to others. Imagine that your mother and all your closest loved ones are there before you. You are radiating love to those close beings. You are giving them happiness. Behind you are your enemies and people you struggle with, and they too are receiving these light rays of love. Now, people who are neutral to you are in a circle outside and surrounding you, and they too are receiving these blessings. Now, these light rays of love are going out to all beings, touching each heart of each being and bringing love and happiness and peace. The whole universe is now filled with love. If you want, you can now say a mantra like love, love, love. Say it to yourself over and over again as you imagine the universe is filled with these light rays of love. Love, 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 love. Love, 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 love. Okay, now stop the mantra. Just rest. Rest in that love just for a few moments. Okay, and of course we want to dedicate, again, we say, by this practice, may I be a better human being and more helpful, able to help others. That's the suggested mantra of love. Again, you can use, through this practice, may I be a better person and more able to help others. You can use any mantra that you like. So now I'd like to talk a little bit about compassion in healthcare. So this is from a recent study at Harvard. They interviewed people and found out that nearly half of Americans believe the US healthcare system and healthcare providers are not compassionate. And 75% of patients and doctors in the study said that it matters so much, it could actually make a difference between life and death. And guess what? They are right. Not only does the Dalai Lama say this, so love and compassion are necessities, not luxuries. Without them, humanity cannot survive. It's not just a statement. This is actually proven in science. And I love this book. I highly recommend that you get it and read it. It's called Compassionomics. Basically, what it is a meta-analysis of the scientific evidence for compassion in healthcare, and that compassion helps in many, many different arenas of healthcare and makes difference in people's lives and in the financial outcomes, better outcomes for the healthcare system. So the definition that this book uses for compassion is the emotional response to another's pain or suffering involving an authentic desire to help. I like to simplify that. My definition is the desire to eliminate suffering. That's it. So in this book, they identified 5 main areas of the effect of compassion, the beneficial effects. There are measurable physiologic effects when you use compassion more effectively in healthcare. There are psychological effects. There's enhanced patient self-care, increased quality of care, and decreased costs of care. And so you can see how not only does it help the patients, but it also helps prevent burnout because you have quality of care and better outcomes. So what are the physiological effects of compassion and meditation and mindfulness? So turns out negative emotions like stress and loneliness cause increased sympathetic nervous system and adrenaline, and increases cortisol, the stress hormone. This is known. We know this. We know that stress does this, but also the parasympathetic nervous system balances that out. And guess what? Meditation and mindfulness increase the activity of your parasympathetic nervous system and decrease your sympathetic. So downregulates the adrenaline and the cortisol, increases oxytocin, which is the hormone of love and bonding, lowers your blood pressure and pulse, and promotes immune responses, just the things that you would want. Compassion does this. For those of you who do delivering babies, OBGYN, in the delivery room, we use the heart rate variability of the baby, monitoring the baby during labor to know that the baby's healthy. Turns out this is also good for adults and other human beings. If we have more predominant parasympathetic activity, we have more heart rate variability. And this is one of the ways that we can look at the physiologic effect of compassion in the doctor's visit. You get more variability of the heart rate when doctors are communicating in a way that is more compassionate. Interesting. So with compassionate doctors, increase parasympathetic nervous system, increase oxytocin, and voila, you have better outcomes. If you look in trauma units, you have 4 times the odds ratio of a better outcome if a compassionate provider takes care of you. Improving the quality of life and palliative care has been shown, reducing the perception of pain, an 80% chance of blood sugar control in diabetes, 41% lower risk of diabetes complications, wounds heal faster, and of course your cold can decrease a day quicker and 15% less symptoms. So it does help. So let's practice a little meditation on compassion, shall we? All right, everybody, once again, take the 7-point posture, just relax. Once again, and we'll use a visualization that has a little bit to do with compassion. The first part of the meditation will be self-compassion, and after that, we will work on compassion for all beings. Just relax, find that peace that you had before. Now I want you to visualize a deity or a person above and in front of you. And this deity or person should represent the most compassionate image that you can create. The deity can be the deity of compassion, Jesus, the Virgin Mary, the Dalai Lama, or anyone who inspires compassion in you. Place that image at arm's length from you and above you in life-size form. Now imagine the quality of compassion radiating from that deity or person and showering down upon you golden rays of compassion that bless you and bring you great peace, and indeed eliminate any and all negativity and suffering that you may be experiencing. Your breathing will now represent the removal of all suffering and the revealing of true happiness. So with each in-breath, you are pulling in all of the blessings and rays of compassion and happiness from the deity. And with every out-breath, all suffering and negativity is leaving your body in the form of soot or dirt, exiting down and out through the soles of your feet. On the in-breath, as you feel these blessings coming into you, you can imagine your body is gradually losing all suffering and negativity, and it flows out with each out-breath. So just sit for a few moments, imagining this cycle of taking in compassion and having all suffering leaving your body. Take that image you have created above you and dissolve it inward into its heart center. Then dissolve that in through the crown of your head. Dissolve all of those qualities down into your heart center. Imagine that all of the qualities of compassion have been dissolved into your body, speech, and mind. Now you have full manifestation of the compassionate quality of your body, speech, and mind. Now imagine that you can radiate out to all beings all compassion and loving qualities. Now that you recognize your own compassionate nature that is luminous and clear, you will share these qualities with others and eliminate their suffering in the process. So now your breath will work in the reverse way. So with each out breath, you will radiate your compassion and it will eliminate all suffering for others. With each in-breath, you will be breathing in the soot of other beings' suffering and negativity. However, magically in your heart center, this soot and smoke becomes purified and is converted into more compassionate and clear energy that you can radiate out again. With each out-breath, as you radiate out these compassionate qualities, you can imagine that your loved ones are right in front of you and they are receiving the blessings of this compassion. With each in-breath, Imagine they too are having all their suffering and negative qualities come flowing out like smoke, and that you breathe this in and convert their suffering into peace and happiness. Expand your awareness to include other beings around your loved ones so that they too can now receive this compassion. Expand your imagined friends and your coworkers, and they too are receiving the blessings of your compassionate radiation. Expand those blessings out to those with whom you have difficulty, and they too are receiving these compassionate blessings from your heart center. Expand to those who you're indifferent to, and they are receiving the blessings in equal measure. Imagine now these rays are going out in all directions to all beings and to all corners of the universe. As your compassion reaches each being, they in turn begin to glow with radiant and luminous light of compassion that also radiates out in all directions, filling all space, reaching all beings, and giving these compassionate and loving blessings. Now rest in that feeling of universal compassion. Rest in your own compassionate nature. So again, we're done with the compassion meditation. We can dedicate and we say, oops, that's my beginning there. Dedication. Through this practice, may I be a better person and more able to help others. So as you might be gathering, you can invent your own meditation. You can pick your own mantra. But again, I recommend you meditate on something positive. Examples are compassion, kindness, love. Pick a concept like purification. So pay attention to your thoughts and turn the thoughts back again and again to the chosen meditation. And as you practice, I guarantee you will start to notice improvement in your mindfulness at work. So some other suggestions for how to be mindful at work. Don't allow interruptions if you can. So in between patient visits, rather than going room to room, you might stop and do labs in between. So if you have a complex patient, what I tend to do, if I try to see one complex patient and I get partway through and go see another complex patient and I go back to the first complex patient, I tend to make more mistakes. What I recommend is if you can really work one complex patient and if you have to leave the room, leave for a few moments, just work on a lab or some small task and then go back to that same room. I think you'll be more mindful, more able to take care of that patient and less likely to have to rework and rethink things. One of the ways that in soccer, they teach goalies to just have one move to the ball. You don't want to second guess yourself, just one move and you go for it. Now that's just a chart as you go and finish it now. Don't save things for later and have to come back and figure out where you were. Be intentional, plan ahead, plan for what you can. These are all ways that we've been taught how to do clinical care, but this is a kind of mindfulness. And if you practice mindfulness intentionally, you will have better outcomes. It's been proven scientifically. So here's just a brief suggestion of meditation. For example, hand washing. Now we have to use hand sanitizer between each patient. And so you can pick your own mantra to say that lasts the right amount of time. Just say it over and over again while you're doing your hand sanitizing. before you greet the next patient. So that's a suggested meditation you can do. Some people have been trained in something called motivational interviewing. And so this is actually a kind of meditation where you, before you go in, you reorient yourself and you say, okay, I'm going to think about compassion. I'm going to think about acceptance and affirmation. I'm going to think about partnering for a positive outcome and evocation of change talk. So this is actually a kind of meditation. You're repeating this thought again and again before you're interviewing a patient or seeing a patient. The point is, make a plan. Make a plan that includes positive repetitiveness, an intentional repetitiveness that prevents emotional exhaustion and depersonalization. Decrease your compassion if you think negatively and increase your compassion if you think positively. So it's not complicated. Remember, you're meditating already positive and negative meditation. So why not choose to meditate on some positive things? If you repeat, you'll get better at it. So be mindful, be more enlightened, be more compassionate, and be more happy. It's scientifically proven, but you have to practice. I recommend you practice a little bit every day. And for an exciting adventure, I recommend, if you want to do some volunteer work in Tibet, this is a One Path Outreach. There's a wonderful medical volunteer organization for those in the medical field. I highly recommend it. Not just doctors and nurses, but also dentists and eye doctors and other specialists who have gone. So hopefully we've reached our objectives talking about burnout and its benefits of meditation, mindfulness, some of the science, basic how to do meditation. And if you'd like to learn more about meditation, I do a lot of teaching on this. This is my podcast. Please join us. We're heard all over the world now, and I'd love to have you listen. And please give me any comments. By the way, it's in Spanish and English, so you can have your patients listen to it. I have it aimed towards a secular audience, and my patients listen to this all the time. And I really recommend it for any person at all, either English or Spanish. Is not just for healthcare professionals. And thank you very much for your time, and I appreciate being allowed to talk. Thank you.